Hello students, this is Professor Henderson again, coming to you again with another lecture, part 3 of the infection control chapter. As always, these videos are meant to deepen your understanding of the material, but they're not meant to replace your reading. So today, if you like this video, by the way, give it a thumbs up so you will never miss another video. So we're talking today about airborne precaution diseases. So as a nurse, it's important to understand what diseases falls under airborne and what are some of the personal protective equipment that are required for caring for patients with airborne disease. So chickenpox, which is varicella, that's transmitted also by airborne. So if patient has that, they have to have two types of precautions. They'll be placed on contact precautions in addition to airborne precautions. Herpes zoster is also, patients with herpes zoster are placed on contact precautions in addition to airborne precautions. Measles, tuberculosis. So as we know, tuberculosis, we have to wear a N95 mask at all times for patients with tuberculosis. If the patient has active TB, the patient is also placed in a negative pressure room, and also cohorting patients with similar type of diseases. So it's important as a nurse to understand what diseases falls under airborne and what are the personal protective equipments that are required to wear. And some of these diseases overlaps with contact precautions in addition to airborne precautions. So we are talking on this slide here about droplet diseases and precautions. So again, it's important to understand what diseases falls under droplets. The whooping cough, the adenovirus. Patients with adenovirus is also placed on contact precautions in addition to droplet precautions. Scarlet fever, the influenza. Patients with influenza, the common flu, are placed also on contact precautions in addition to droplet precautions. Meningococcal meningitis, mumps, sepsis, mycoplasma pneumonia. So wear personal protective equipments, and patients that are placed on droplet precautions have to wear also a surgical mask along with standard precautions. Now we're talking about contact precautions in this slide. So what are some diseases that falls under contact precautions? So we have MRSA, methicillin-resistant Staphylococcus aureus. We have VRE. We have C. difficile, C. diff toxin, RSV, the parainfluenza, and conjunctivitis. Also, we have skin infections. Examples of skin infections are impetigo, lice, scabies versus herpes simplex. So these diseases, we have to use contact precautions. It's important to understand what diseases falls under contact precautions and what PPE is required. So we have to wear gloves, gown with every contact precautions, and follow standard precautions. In this slide, we have to talk a little bit about the responsibility of an infection control professional nurse. So as a nurse, if you work as an infection control nurse, some of the duties and responsibilities of an infection control nurse is to utilize evidence-based practice in preventing hospital-acquired infections. Also educate staff and patient on infection prevention. A lot of times the infection control nurse will conduct in-services, and these in-services are on various topics. Some of them might be on safety, some might be on hand hygiene, some might be on application of personal protective equipment, so on and so forth. So the third responsibility of an infection control nurse is to develop and review infection prevention control policies and procedures. So it's important. A lot of facilities have current policies, and some of these policies might be updated. So as a new infection control nurse, you'll be reviewing those policies and procedures, and you will also be updating these policies and procedures to reflect new changes as things evolve and things change over the years. Recommend appropriate isolation procedures for specific situations. Monitor antibiotic-resistant organism in the institution. Notify the public health department on incidents of communicable diseases within the facility. So as an infection control nurse, you will be tracking communicable diseases, and you will be reporting these communicable diseases to the Center of Disease Control. So it could be a statistic such as tuberculosis. I have a simple case study here. I'm going to read it for you. Mrs. Eldridge is a 63-year-old woman who underwent a total hip replacement. Kathy Jackson is a nursing student caring for Mrs. Eldridge on her home health clinical rotation. 2 weeks after the surgery, Mrs. Eldridge complains to Kathy that she has increased pain in her hip and low-grade fever. Kathy observes the incision and notes that it is red, swollen, and warm to touch. So, critical points. What does the fever, erythema, warmness at the incision site indicates? Obviously, we can see these objective symptoms, so to speak, is pointing at a localized infection. Mrs. Eldridge is probably coming down with the localized infections. So what should be the next step that the RN should take based on her clinical findings or assessment? So the next step is that the nurse will, after conducting her physical assessment, she's going to call the doctor and inform the doctor of the clinical presentation. And the doctor may order a culture of the site, the incision site. The doctor may want to start the patient on a broad spectrum antibiotics. Maybe the doctor may order some pain management for the clients. Name 4 interventions that the RN should do. So what are some things you're going to do for your patient as a nurse? The site is swollen and it's warm to touch and it's red. So some things you can do, you can elevate that extremity to decrease the edema. You can probably also apply maybe a warm compressor to that site. You can administer the pain medication as ordered by the physician, or also obtain a culture of the incisional site and administer the antibiotic as ordered. And also teach your patient about keeping the site clean and dry to prevent further infection, to take the medication as ordered, and to observe for any signs and symptoms of adverse reactions to the medications. This slide here talks about healthcare associated infection. So healthcare associated infections are infections that occur in a healthcare facility. Patients at greater risk for healthcare associated infections are patients that have multiple illnesses, specifically geriatric patients, patients that are poorly that that are not properly nourished, patients that have compromised immune systems, and patients with chronic illnesses. So what are some examples of healthcare associated infection? So we have here Klebsiella, which is a central line associated bloodstream infection. We have CAUT, catheter associated urinary tract infection, and we have surgical site infections. So these are examples of hospital acquired infections. So these infections can be preventable. So if we, as nurses, if we use proper personal protective equipment, if we maintain sterility when we're changing or inserting a Foley catheter, or if we're doing a dressing on a patient with a central line, and we're following strict sterility in performing the dressing. So these infections, these hospital-acquired infections, can significantly be reduced. So that is for this slide. Talked about that. So we have types of healthcare associated infections. We have the iatrogenic infection. So iatrogenic, it's from a procedure such as a bronchoscopy or a broad spectrum antibiotics. It's imperative to practice good infection control practices during every procedure to decrease the incidence of iatrogenic infections. Exogenous infection is from microorganisms outside the individual, such as the Salmonella, the Clostridium tetani, or the Aspergilus. So these are examples of the exogenous infection. An endogenous infection is when the patient's flora, body normal flora, becomes altered and there's an overgrowth resulting probably of a yeast infection or a staphylococcus or enterococcus infection. So it's important to understand these different types of hospital acquired infections and what are the interventions in terms to minimize these types of infections. So factors influencing infection prevention and control. So we know that patients that are the very young and also the very old, patients that are elderly patients that have immune system is compromised, they're at increased risk for infections. And as we know, when you're very young, your immune system is not fully matured, so you're also at increased risk for infections. Nutritional status: if you're not eating healthy, you're not having adequate amount of protein, that also can place you at an increased risk for infection. Also stress: how do you manage stress? It's important. Stress plays also a huge role in terms of infection. So it's important that you manage your stress effectively and develop effective coping skills to decrease your stress levels. So certain treatments also can compromise one's immune system and ability to fight off infection, such as chemotherapy. Patients have cancer and they're receiving chemotherapy or radiation therapy. That also lowers their immune response to fight infections. Or patients that are receiving long-term steroid therapy also lower their risk for fighting infection. Weak immune system, certain diseases like advanced cancers, advanced HIV, their immune system is